From babies born with mermaid legs to a man who grew a horn out of his head.
I cannot move this arm away from my body. It's like super glued to my side, my upper arm, because it does not move.
These cases baffled doctors and rewrote textbooks. These are 20 of the strangest body parts ever found on humans. Number 20. Cyclopia, single eye. Just a quick heads up. The condition we're about to talk about can look very graphic, so viewer discretion is advised. In 2006, doctors in Chennai, India, delivered a baby that stunned the entire medical team. She had one central eye and no nose. The condition is called cyclopia, the most severe form of something known as holoprosencephaly. In this condition, the front of the brain does not split properly, and because the brain drives how the face develops, the baby is born with a single fused orbit. Cyclopia isn't just about one eye. It comes with major problems in the brain and other organs, which is why babies almost never survive more than a few hours. In the Chennai case, the little girl passed away shortly after birth and was recorded only as baby of Gomathi, without a name, to protect the family's privacy. Doctors suggested two likely causes: a chromosomal disorder like trisomy 13, or disruption of the sonic hedgehog pathway, a critical signal that tells the midline of the brain and face how to form. Around the world, the condition is incredibly rare, estimated at about 1 in 100,000 live births. Sometimes ultrasound or MRI can detect it before delivery, giving families a chance to prepare for comfort care. Number 19. Fetus in fetu. Sanju Bhagat was a 36-year-old farmer in Nagpur, India, when his life suddenly changed in June of 1999. He had been struggling to breathe, his belly was swollen, and doctors thought he had a massive tumor. When surgeons opened him up, what they found shocked everyone. Inside his abdomen were limbs, hair, and even nails. It wasn't cancer at all. It was the remains of his own twin. This condition is called fetus in fetu. Unlike a typical tumor, fetus in fetu has a spine or other body structures, showing it once tried to form as a twin. Scientists say it's incredibly rare, happening in about 1 out of every 500,000 births. And what makes it even rarer is that it happened to an adult. After doctors removed the malformed twin, Sanju finally recovered and went back to his normal life. Number 18. Fibrodysplasia, ossificans progressiva, FOP, Stoneman syndrome. When Ashley Kurpeel was just a little girl in Georgia, doctors thought she had cancer. At only 2 years old, they amputated her right arm and part of her shoulder to stop what looked like aggressive tumors. But later, the heartbreaking truth came out. It wasn't cancer at all. Ashley actually had a condition called Fibrodysplasia ossificans progressiva, or FOP for short. This is a genetic disease where muscles, tendons, and connective tissue slowly turn into bone. It's like the body is building a second skeleton around itself. The first clue many patients are born with is a strangely shaped big toe. But even doctors often miss that sign. Small injuries, like a bump or even a deep injection into the muscle, can trigger new bone growth that locks up joints forever. In 2006, scientists discovered that almost every single case of FOP is tied to a switch in one specific gene called ACVR1. That tiny error tells the body to keep laying down extra bone, which is why the disease never really stops. It's incredibly rare, happening in about 1 in every 1 million people in the United States, which explains why Ashley's condition was misdiagnosed at first. For decades, there was no treatment at all. But in August of 2023, the FDA approved a drug called palovarotene, brand name Sohonos, that can help reduce the amount of new bone forming in some kids and adults. Ashley has spent her life sharing her story, warning doctors and families about the dangers of misdiagnosis, and showing how even small things like dental work or a fall can spark painful flare-ups. Her courage has not only given families hope, but has also pushed scientists to keep fighting for better treatments. If left untreated, FOP steadily locks the body in place. Joints freeze, the jaw can close permanently, and the rib cage can stiffen until breathing becomes a struggle. Many patients need help walking by their 30s, and eating can become nearly impossible. The greatest dangers are pneumonia and cardiorespiratory failure when the chest can no longer expand, often cutting lives short in the 40s or 50s, though some survive longer. Number 17. Diprosopus, facial duplication. Lali Singh's story is one the world will never forget. She was born on March 11, 2008, in Saini Sunpura, near Delhi, with a single body and skull but duplicated facial features, 2 pairs of eyes, 2 noses, and 2 mouths. Villagers briefly celebrated her as a reincarnation of the goddess Durga, and her parents, Sushma and Vinod Singh, brought her home after birth. Doctors explained that this was Diprosopus, not conjoined twins. In Diprosopus, parts of the face are duplicated on a single head. Research ties it to disruptions in the sonic hedgehog signaling pathway, which normally helps shape the midline of the developing face. When that pathway goes wrong, midline structures can widen or even duplicate. It is among the rarest craniofacial conditions ever recorded, with only a few dozen documented human cases across centuries. Most cases are fatal before or just after delivery. Media accounts say Lali Singh's family declined early CT and MRI scans, which meant doctors could not map her brain or airway. Feeding was complicated by a cleft palate, and her 2 central eyes developed corneal damage because they could not close properly, issues tied to malformed eyelids and facial muscles. Most Diprosopus cases today are picked up by prenatal ultrasound and further studied with fetal MRI when possible, so doctors can plan for delivery and airway management. There is no single surgical fix, since every case differs. Survival depends heavily on the brain, spine, and airway anatomy, which is why almost all complete duplications are fatal. Lali lived about 2 months before passing away from a reported heart attack after a short hospitalization. A small temple was later built in her village to honor her memory. Number 16. Hypertrichosis, werewolf syndrome. Supatra Nati Sasafan from Thailand first caught the world's attention in 2011 when Guinness World Records named her the hairiest child. She wasn't seeking fame, but her condition was impossible to ignore. Natty was born with hypertrichosis, often called Ambrus syndrome, a condition so rare that fewer than 50 cases have ever been documented worldwide. This condition causes fine but thick hair to grow across areas it normally wouldn't, like the cheeks, forehead, ears, and shoulders, while sparing spots like the palms and soles. Instead, hypertrichosis is an entirely separate condition, often present at birth, where hair follicles simply behave differently. Number 15. Parasitic twin. Baby Dominique was born in Côte d'Ivoire with something doctors almost never see: the remnants of a twin fused to her back and neck. Attached were 2 legs, a pelvis and bladder, a second spine intertwined with her own, and even tiny feet with toenails. At just 10 months old, she was flown to Chicago for help. There, a large team at Advocate Children's Hospital mapped every detail of her anatomy with MRI, MRA, CT scans, including a CT pyelogram, X-rays, and even a full 3-dimensional model to plan the operation. On March 8, 2017, 5 surgeons spent about 6 hours separating Dominique from her parasitic twin. Doctors explained that her own heart and lungs had been supporting both bodies, which is why careful imaging and staged planning were so critical. Incredibly, she was able to leave the hospital just 5 days later. During her recovery, Dominique lived with a Chicago host family led by Nancy Schwab, arranged through Children's Medical Mission West. The plan from the beginning was for her to return home after rehabilitation. Follow-up checks showed she was thriving, and by late April, she was cleared to travel back to her family in West Africa. Cases like hers fall under the classification of parasitic twin, an incompletely formed twin that survives only by relying on the healthier twin, known as the autocyte. It is one of the rarest events in medicine, occurring in about 1 in 1 million births. Survival depends on whether organs and vital structures are shared, which is why Dominique's case became a model example. Number 14. Polydactyly, extra fingers and toes. In November of 2014, Guinness officially confirmed that Devendra Suthar has 14 fingers and 14 toes, the most ever recorded on a living person. His condition is called polydactyly, a genetic difference where people are born with extra digits. In some cases, these extra digits are just small, soft nubs that can be tied off or removed easily. But in Devendra's case, every single finger and toe is fully formed and usable. This makes his record especially striking. Polydactyly is actually one of the most common hand and foot differences at birth, appearing in somewhere between 4 and 12 out of every 10,000 babies worldwide. But what makes Devendra unique is how complete and symmetrical his extra digits are. Working as a carpenter, he has to be extra careful to protect his unusual hands. Number 13. Vestigial human tail. Chandra Oram, a tea plantation worker from West Bengal, became famous around the world for something most people thought was impossible: a human tail. Guinness World Records documented the growth at 1 foot 1 inch long, about 13 inches, extending from his lower back. People gathered out of curiosity, but the truth behind it is rooted in science. Doctors divide so-called human tails into 2 groups. A true tail is a soft stub of skin, fat, and maybe tiny muscles near the tailbone. A pseudo-tail looks similar, but is usually linked to spinal problems like a lipoma or a small defect in the spine. Most cases fall into the pseudo-tail category, which is why surgeons always use MRI or CT scans before removing one. Oram's case has no detailed medical scans in public records, so doctors can't say for sure which type his was. Number 12. Lithopedion, stone baby. When 92-year-old Estela Melendez from La Boca, Chile, went to the hospital after a fall, no one expected the discovery that followed. Doctors ran imaging tests and were stunned to see the outline of a fetus inside her abdomen. But this wasn't the same as the fetus in fetu case we discussed earlier. It was something entirely different. This fetus had been there for more than 50 years. Over time, it had died and slowly calcified into what medicine calls a lithopedion, or stone baby. In simple terms, when a pregnancy develops outside the uterus or goes unrecognized, the body sometimes surrounds it with calcium to protect itself, almost like turning it into stone. Estela's case explained why she was never able to have children, and reports noted the calcified fetus weighed about 4.4 pounds. Because of her advanced age and the fact that it wasn't causing new health problems, doctors chose not to remove it. Lithopedion is one of the rarest medical events known, with fewer than 300 cases reported worldwide in over 4 centuries. It happens in only about 1.5 to 1.8% of abdominal pregnancies, or roughly 5 in every 100,000 pregnancies. Another famous example was Zara Aboutalib in Morocco, who unknowingly carried a calcified fetus for 46 years before doctors discovered it. These stories show how the body can react in strange and unexpected ways to protect itself. Number 11. Ectrodactyly, split hand and foot. Bree Walker, a well-known American television news anchor and actress, made history by refusing to hide her hands on air. She was born with ectrodactyly, often called split hand and foot malformation. In this condition, the middle part of the hand or foot is missing or shortened, leaving a V-shaped cleft that resembles a lobster claw. What makes it unique is how much it can vary, even within the same family. Some people have just one cleft hand. Others have multiple limbs affected. Bree chose to embrace her difference openly, showing millions of viewers that the condition does not define her talent or career. Another widely recognized case was Grady Stiles Jr., nicknamed Lobster Boy, who came from a long family line of people with Ectrodactyly and became known through sideshow performances and later news reports. Science explains it clearly. Most cases fall under split hand-foot malformation, or SHFM, and can be inherited in several ways, often autosomal dominant, which means only one altered gene is enough to cause it. It is rare, appearing in roughly 1 in 18,000 to 1 in 90,000 live births, depending on the study. Daily life is still very possible. Many people adapt with custom grips, tools, or surgeries focused not on appearance, but on comfort and function. Number 10. Giant congenital melanocytic nevus. Didier Montalvo, a boy from Colombia, was born with something far more visible, a giant birthmark that covered most of his back like a shell. It was a giant congenital melanocytic nevus, a rare pigmented mark present from birth that can grow thick, bumpy, and even hairy. Didier's was so large that neighbors in his village called him Turtle Boy, a nickname that weighed heavily on him. The medical concern with nevi this size is twofold: the risk of melanoma and the chance of a related condition called neurocutaneous melanosis, where the brain or spine develops abnormal pigmented cells. Doctors often screen patients with MRI to check for that before planning treatment. For Didier, the answer came when UK surgeon Neil Bulstrode flew to Bogota and worked with local doctors in a series of operations. They removed the massive nevus in stages, used grafts and tissue expansion to rebuild skin across his back. And by the time he was 6, he was recovering with a new sense of freedom. Number 9. Progeria, rapid aging. Sam Burns, a teenager from Massachusetts, became the face of a condition few had ever heard of, and he handled it with incredible strength. He was born with progeria, a disease that makes kids age much faster than normal because one tiny change in the LMNA gene produces a toxic protein called progerin. The biggest danger isn't wrinkles, it is the early hardening of blood vessels, which is why, without treatment, many children pass away from heart attack or stroke in their mid-teens. Progeria is extremely rare, showing up in only about 1 out of every 4 million births, with only around 400 children known worldwide. Sam shared his wisdom in his TEDx talk, My Philosophy for a Happy Life, inspiring millions around the world before passing away in January of 2014 at just 17 years old. His family went on to co-found the Progeria Research Foundation, which pushed research and awareness in ways never seen before. That effort led to a major turning point in November of 2020, when the FDA approved lonafarnib, sold under the name Zokinvy. It became the very first treatment for progeria. Studies show that it helps keep arteries more flexible and reduces the chance of early death, so doctors now begin treatment as soon as possible. It is not a cure, but it gives children more time and a better quality of life. Number 8. Sirenomelia, fused legs. Shiloh Pepin, a girl from Maine, captured hearts around the world because she lived with a condition so rare that most newborns don't survive more than a few days. She was born with sirenomelia, sometimes called mermaid syndrome, where the legs are fused together and many internal organs don't form correctly. In Shiloh's case, her kidneys failed early, yet she kept defying the odds. She underwent 2 kidney transplants, the last one in 2007, and continued to thrive far longer than doctors ever expected. Sadly, she passed away at just 10 years old in October of 2009 from pneumonia. The science behind Sirenomelia is tied to an abnormal blood vessel pattern in the umbilical cord, where a single artery steals blood flow from the lower body during development. This disrupts the growth of the kidneys, bladder, and even the lungs, which is why most babies don't survive. Studies put its prevalence at roughly 1 in 70,000 to 1 in 100,000 births. A handful of children like Shiloh did live beyond infancy. Tiffany Yorks in Florida, who had her legs separated in infancy and lived to age 27, and Milagros Cerón in Peru, who underwent staged leg separations and survived until 15. But their stories remain the rare exceptions in an already rare condition. Number 7. Macroglossia, giant tongue. Paisley Morrison Johnson, a baby from Aberdeen, South Dakota, captured national attention because her tongue was more than twice the size of her mouth, making it nearly impossible to breathe or feed. Doctors diagnosed her with macroglossia, a condition where the tongue is too large for the mouth. She was flown about 200 miles to Sanford Children's Hospital in Sioux Falls, where a father and son surgical team prepared tongue reduction procedures. After 2 operations before she was 16 months old, she could finally close her mouth, eat properly, and even smile. Macroglossia can be either true enlargement, where the tongue tissue itself has grown too much, or relative enlargement, where the tongue only looks oversized because the jaw or nearby structures are smaller. One of the most common genetic causes in newborns is Beckwith-Wiedemann syndrome, an overgrowth disorder where a large tongue is one of the classic signs. Babies with this condition are monitored closely since they can have low blood sugar soon after birth and face a higher risk of certain childhood tumors. Because of that, routine screening with abdominal ultrasounds and blood tests is standard during the early years. Treatment usually takes a team approach. Speech and feeding therapy help with function. Sleep studies check for apnea, and orthodontists guide jaw growth. When the tongue constantly hangs out, blocks the airway, or pushes the bite out of place, surgery becomes an option. Tongue reduction procedures remove tissue while protecting taste and movement, and research shows that early, carefully timed reductions lead to better breathing, improved sleep, clearer function, and healthier jaw development in infants who truly need it. Number 6. Situs inversus, mirrored organs. Rosemarie Bentley of Molalla, Oregon, lived to the age of 99 without ever knowing she had situs inversus with levocardia, a rare condition where the organs are flipped from their usual positions, but the heart stays on the left. Only after she donated her body to science did students at Oregon Health and Science University discover the surprise. Her liver and gallbladder sat on the left. Her stomach and spleen were on the right, yet her heart remained in its normal place. Situs inversus simply means the body's internal map is mirrored. In the more common form, called situs inversus totalis, even the heart points to the right. A setup also known as dextrocardia. In situs inversus with levocardia, only the abdominal organs are reversed, while the heart stays left-sided, as in Bentley's case. Doctors estimate the condition occurs in about 1 in every 10,000 people. Most people with it feel perfectly healthy and may never realize anything is unusual. The real challenge comes in emergencies. Classic left-sided pain from appendicitis, for example, can appear on the right when the organs are flipped. Because of this, doctors rely on imaging such as CT scans to confirm the layout before surgery. Sometimes situs inversus is part of Cartaginer syndrome, a rare disorder in which the tiny cilia in the body do not move properly. In this case, flipped organs come with chronic sinus infections, bronchiectasis, and sometimes fertility issues. While most people with situs inversus live normal lives, congenital heart defects show up in roughly 5 to 10% of cases with total organ reversal, which is why careful heart checks are important. Bentley's story shows the other side. A mirrored body that never caused her trouble and was only revealed at the very end of her long life. Number 5. Cutaneous horn. Horn growing from skin. In 2019, 74-year-old farmer Shyam Lal Yadav from Madhya Pradesh, India, made headlines when a hard, cone-shaped horn sprouted from his scalp and grew to about 4 inches long. For years, he had his barber trim it down, but once it started growing faster, he turned to doctors at Pagyode Tirth Hospital. Scans showed it had not spread into the skull, so surgeons removed it properly and sent the base for testing. This unusual growth is called a cutaneous horn. It forms when keratin, the same protein that makes up hair and nails, piles up into a spike on the skin. These horns often appear on sun-exposed spots, like the scalp, face, ears, and hands, especially in older adults. The horn itself is not the real issue. The concern lies in the skin at its base. Studies show that about 16 to 20% of cases hide a skin cancer underneath. Roughly 23% sit on top of pre-cancerous changes, and the rest turn out to be harmless growths. That is why doctors always test the base before deciding on treatment. Management depends on what is found. If the base is benign, a simple removal is enough. If it is precancerous or cancerous, surgeons take a wider margin and follow up closely. Number 4. Harlequin ichthyosis. Armor skin. Nusreet Nellie Shaheen from Coventry, UK, has lived her whole life with Harlequin ichthyosis, a condition so rare that many doctors may never see a single case. She's been open about her journey, often sharing how daily care and family support have kept her going, and is believed to be the oldest person in the UK living with this condition. Babies with Harlequin ichthyosis are born with skin that looks like thick diamond-shaped plates. That tight outer layer cracks, leaks fluid, and can even pull the eyelids and lips outward, which is why newborns go straight to intensive care. The science is clear. This happens because of mutations in the ABCA12 gene, which normally helps build the skin's barrier. Without it working properly, the skin can't keep moisture in or germs out. It's incredibly rare, estimated at about 1 in 300,000 births. Care has to be constant to prevent infections, keeping the skin soft with creams, humid air, and protecting the eyes and fingers until the skin loosens. Some babies are treated with oral retinoids that thin the plates, while others do well with modern neonatal care alone. Survival has improved dramatically compared to past decades, thanks to standardized protocols in children's hospitals. Number 3. Ectopia cordis. Heart outside the chest. Surviving with your heart outside your chest sounds impossible, but 2 children proved it can be done. Audrina was born in 2012 with her heart partly exposed. Doctors at Texas Children's Hospital had already prepared for her arrival after spotting the condition on a 16-week ultrasound. During infancy, they tucked her heart back inside and fitted her with a protective shield. After about 3.5 months, she was able to go home, with plans for a permanent internal shield as she grew and close follow-up from her cardiology team. Versavia's journey played out differently. She was born in Russia with pentalogy of Cantrell, a syndrome that can leave the heart just beneath the skin instead of behind bone and muscle. In 2015, she and her mother moved to the United States in hopes of repair. But after testing, doctors at Boston Children's Hospital deferred surgery because of dangerous pressure in her lung arteries. She later settled in Florida, where she protects her heart with a chest covering and continues regular medical care. The condition behind both stories is ectopia cordis, which happens when the breastbone and front body wall fail to close early in pregnancy, leaving the heart partly or completely outside the chest. It is extremely rare, only about 5 to 8 cases per 1 million births. Survival depends on how far the heart is displaced and whether other defects exist. Complete cases are usually fatal, while partial ones can sometimes be managed with staged surgeries like Audrina's. Ectopia cordis often appears as part of pentalogy of Cantrell, which affects the heart, pericardium, diaphragm, lower sternum, and abdominal wall. Prenatal ultrasound and fetal MR. I now help teams spot and plan for it before delivery. But even with modern tools, survival is rare. That is why long-term survivors like Audrina and Versivia are so remarkable. They show what it means to beat impossible odds. Number 2, heterochromia, 2 different eye colors. English actress Jane Seymour has always drawn attention for her unusual eyes. The media often say one is green and the other is brown, but Seymour herself explained that both are actually blue. One has a brown stripe, and the other has brown circling the pupil. Depending on the lighting, they can look completely different. That makes her a real-world example of heterochromia. Heterochromia simply means eye colors do not match. Sometimes each iris is a different shade. Sometimes a section of one iris shows another color, and sometimes rings of a different hue appear around the pupil. Doctors group these into 3 types: complete, sectoral, and central. Based on her own description, Seymour shows sectoral and central patterns rather than pure, complete heterochromia. How rare is it? Studies suggest that about 6 in every 10,000 people show heterochromia in photographs, and estimates put the total at fewer than 200,000 people across the United States. For most people born with it, the difference comes down to how much melanin pigment each iris received before birth. In some cases, though, it can be tied to pigment disorders like Waardenburg syndrome or to congenital Horner syndrome, where the lighter eye may also have a smaller pupil and a subtle eyelid droop. It can also develop later in life. Causes include eye injury, long-term inflammation such as Fuchs' heterochromic iridocyclitis, or even glaucoma eye drops called prostaglandin analogs, which darken the iris by increasing melanin. In those cases, doctors treat the underlying condition rather than the color itself. Most people never need treatment. If the look bothers them or the light feels harsh, tinted contacts or sunglasses can help. The only real warning sign is a sudden change in eye color or new issues like pain and blurry vision. That is when it is important to see an eye doctor right away. Number 1. Coloboma. Stephen Nedoruskic, a U.S. Olympic gymnast, lives with an eye condition called coloboma. Because part of his iris never fully formed, bright light is overwhelming for him. He wears glasses outdoors to cut the glare, but when he competes, he goes without them, relying on muscle memory and rhythm instead of sharp vision. Coloboma itself is rare, affecting about 1 to 2 cases in every 10,000 births. It's one of those conditions that people notice right away because the eye looks different. It has a slit or keyhole shape instead of a perfect circle. That dramatic look comes from something very simple. Before birth, the eye develops in halves that should seal together. But in coloboma, the seam doesn't close all the way. Depending on where that gap is, whether it's in the iris, the retina, or even the optic nerve, vision can range from almost normal to seriously reduced. People with this condition often face problems like glare, light sensitivity, or even the risk of retinal detachment later in life. Treatment is highly individual. Tinted lenses can make light more comfortable. Low vision tools help in daily life, and surgery may be used when the iris is affected to create a rounder pupil. The human body can be stranger than fiction, but every rare case is a real person with a story worth telling.